Hi, I'm Robert Berenger, and I'm talking with Dr. Brian de Vries about end-of-life conversations and LGBT aging. And I just want to ask about HIV and AIDS and what impact do you think that's had on how people plan for end of life?
I think HIV and AIDS has had a profound effect on the aging in the LGBT community, especially in the gay male community, but certainly more broadly in lots of ways. For one, what many older gay men especially now have reported in our research and others that they never expected to live this long. So they've really outlived their expectations and in some ways outlived their resources. So they're now in their later years without the sort of resources they might have otherwise expected to support their later years. They're also, and this is important I think, in their later years without the community with whom they expected to age. And it's a sad statement of how many older gay men reported having buried all of their friends in the 80s and in the 90s. And those are the people they might have expected to grow old with, to provide care for and receive care from. And so their experience in later life then is different than what they might have anticipated and certainly different than comparably aged heterosexual men. But I think AIDS and HIV has had an effect on the community as a whole, even amongst those who are HIV negative, for example. They too had experienced the sort of intense discrimination of those living with HIV in the 80s and 90s and sadly continue, I think. But it also colors what later life is. I mean, so many of those in the LGBT community rose to the challenge in the early years of HIV and AIDS at a time when governments and other communities really shamefully turned their backs. So in the absence of those forms of support, those organizations to care for people who were dying, the community itself and lesbians in huge numbers rose to the challenge here to provide those services and ensure that care was being provided. So in some ways, they have a handle on how to address this sort of crisis. But age is not the crisis that HIV and AIDS was. And many, I think, within the community think that we could call up that effort again, call up that energy and provide care for the aging LGBT population. But there isn't the same sort of crisis, there isn't the same sense of injustice that existed 15, 20 years ago. We have the experience there if only we knew how to call upon it, I think, to provide for older LGBT people an affirmative, compassionate way of providing care for end of life. We need somehow to be able to capitalize on that.